Hey, I'm Dr. David Haase, and I'm sitting here with a measuring device that measures something remarkably important, which is your automatic nervous system, or really what we call it, the autonomic nervous system. This is the part of your nervous system that regulates all the automatic things inside of your body with regard to how fast should your heart beat, how fast should you breathe, how much tears should you make, how many juices should you make in your gut, what temperature should your skin be, how much should you sweat, everything that's going on right now that you are taking for granted. That is your autonomic nervous system. And we talk about it having two sides. One is the sympathetic side and the parasympathetic side. And the sympathetic side, you may have heard of this. This is your fight or flight or freeze response. When you come into immediate stress, your heart rate goes up and your stress level goes through the roof, right? And that's to help you survive an attack of something. And that's your sympathetic nervous system. Your parasympathetic nervous system, on the other hand, is not there to, fight, flight, or freeze. It is there to rest, digest, and repair. And so this is the state you go into after you've eaten a meal. And a lot of blood needs to come to your gut to do its job of processing and eat all the food, right? And it's also this is what happens in deep rest and relaxation. Well, now, we need both of these things, don't we? And we need to be able to alternate between them. So we need to have variability. So I think of this autonomic nervous system is healthy when it can do what an athlete does. An athlete always has a ready stance. That's kind of has a bounce in the knees, right? The lower the center of gravity. That means so they can go any direction that they need to very quickly. Knees aren't locked, right? And they're not laying on the ground. They're standing there with a ready. They have variability in their stance. So if we want to understand this super important system in your body, we can measure it via the variability of your heart rate. You might not know this, but your heart does not beat regularly. Well, mostly regularly, but it's regular with variability. So when you breathe in, your heart beats faster. And when you breathe out, your heart beats slower. So it kind of goes bum, 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 as you breathe in, and boom, 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 as you breathe out. And that's like an athlete having great variability. They're ready to go, ready to adapt to anything, any challenge that may come their way. So we measure this heart rate variability, and that lets us know how good your stress and your recovery system are, and how well you can go in between those according to the demands of your day. So we want to see that you can that you live most of your life in between those two states, that you're not having to go down to recover, and you're not having to run away from something terrifying or dangerous, that you're living your life here in the middle of regular variability and readiness. This is important for every human to understand. This is one of the most important things that you can do to know where you are with regard to stress and recovery. So we're so proud. We've been doing this test on every patient that's come through MaxWell Clinic for 20 years, and that's as long as our clinic has been open. And we teach tools about how to better understand this in your body, and it helps us guide many other therapies. So talk to your MaxWell Clinic clinician about this, and make certain that you get the data you need in order for you to thrive to your best life.